So I'm David Bergman. I'm the Associate Professor of Pediatrics in the Division of General Pediatrics at Stanford University and Lucile Packard Children's Hospital.
And what's the problem or issue you're trying to address?
Well, I think we've done a great job over the last couple of decades in bringing evidence-based medicine to bear in pediatric practice. I think our current gap is, even though we know what evidence-based practice is, how do we spread it such that it's used by a variety of people in different settings? And I think this is our next challenge. And what I hope to address in the paper today was basically to look at the issue of how we spread effective interventions and what can we learn from dissemination science in terms of being able to spread what's effective to the people that need it.
So you covered a little bit of the second question in that one, but the second question is, what does your paper or study do? So do you want to get into...
Sure. So what we've tried to do in this paper is summarize a large body of literature, and it's intended to give pediatricians an overview of what the science is out there and what tools and methods are available to them. I think this could be a fruitful marriage between social science and pediatric medicine, in that there are a lot of techniques that you can use both in designing and implementing research that will be helpful in ensuring that your results are spread downstream.
What is new or useful about your work?
Well, I think what is new is really exposure to a new field that pediatric researchers have not been intimately involved with, and I think this really involves a mixture of social science and, in all honesty, some marketing techniques such that we really begin to understand our target population in greater detail and how we can design interventions to really be tailored to the needs of different groups and different venues. Too often when we start a research project, it goes very effectively. In the beginning we publish it, and then it tends to die on the vine. It doesn't spread to new sites and to new target populations. What we've hoped to do in this article is really expose researchers and practitioners to some of the methods that can be used to ensure that they do get widespread use of their results.
And how does the viewer or reader in this case, how can they use your work?
Well, I'd hope they'd look at it first of all in terms of overall perspective. You know, what is available to them? How can this broaden their horizons? And I really see it being used in two ways. One, if you begin to think about these questions about how effective interventions are spread right from the get-go, you're going to design your research in such a way that it is more likely to be spread. The second area I think it can be useful for people is that if you have effective interventions, what was done in the study may not be exactly what you're trying to do. In other words, those people who are in the study may not be exactly the same as the people you're trying to target, and the methods that you used in that study may be more resource intensive and more rigorous than you can possibly do in your setting. What I've hoped to do is to tell you some methods about how you can translate from the research setting to the real world setting in trying to put evidence-based practice to bear on your patients.
And are there any other learnings?
Well, I think only that this is really an opportune field, I think, for joint research for pediatricians and social scientists. So I'd hope we would go forward and explore some questions about how we can design more effective research, how we can become more pragmatic in our approach to both do research and ensure that it's spread. And I'm hopeful that this will be a fruitful area in the future.
And finally, is there anything that you may want to tell them that wasn't on the paper?
You know, I think really it's been a new and enlightening area for me. So I think what's of interest in the exploration we did in doing this paper has had an impact on the research and has had an impact on my daily practice, and I'm really hopeful that I can share my experience with others.